Hello again, this is Steve Moreland with The Natural Upgrade. We're sponsored by Nature's Pure Blend, and today we're going to be focusing on nitric oxide. And we are going to have a guest on today that has a unique background, not just from an educational standpoint, but from an experience and an application practical standpoint that's going to give you some insights, but also give you what I believe are going to be tips, tricks, and even techniques that are going to make a difference in your life if you stay tuned to this podcast. Dr. Peters, I've got a chance to meet you and learn about you and learn about your passion and what you do and how you do it. Introduce where you're from, and then tell us how you got on this journey and how you became.
Thanks for having me, Steve. I appreciate it. So I'm from just outside of Cleveland, Ohio, and I have a doctorate in exercise physiology. I'm also a professor of applied exercise science and human performance. I ended up starting on this journey in a bit of a unique path. I've always had a passion for exercise and health and fitness. Actually, as a child back in the 90s, there was like an ab roller device that had came out. And I think I was like 11 and I had asked for that for Christmas. So what 11-year-old asks for a device like that for Christmas? But I always had a passion for fitness and for health. And as I've gotten older, I think looking back, it may have been a result of me just needing to expend extra energy as a kid. Now that I have two children of my own, I see how hyper and active they are. And so I hear myself telling them the same thing my grandparents told me when I was real hyper. It's do some push-ups, do some jumping jacks. So trying to, I think, just alleviate that excess energy. I have a business here in town called The Fitness Doctor, and it is a clinical approach to exercise. So a lot of places and growing up in the gyms and always being active and exercising, I, over the years, really found a need for an approach to exercise that was more than just building big biceps, right? You go into the fitness centers and trainers working with clients of different ages, and they're all doing the same thing, right? And that's not how it should be. My belief is that everyone should have an prescribed exercise program based on their needs, right? So if you and I were in the same fitness program, we shouldn't be doing the same things. And so that's really what got me started on this path was I found there was a real need for a scientific clinical approach to exercise that went beyond just your average, let's make this individual sweat and build big muscles. And there's more to it than just that.
You approach it, sounds like, with a significant level of science. And I'm going to imagine that your results actually speak for themselves.
Oh, for sure. And I've been doing this for nearly 15 years. And the individuals that I see are largely a clinical population. Some folks just come in for weight loss, but mostly they're people that have hypertension, diabetes, orthopedic limitations, neurocognitive impairments, and they don't feel comfortable or safe going to just your average trainer. My dissertation focused on the effects of cognitive improvement with people that have dementia, Parkinson's, and Alzheimer's, and creating a program for those folks to enhance their capacity and improve neuroplasticity.
Wow.
And so there's definitely more that goes into it than just saying, hey, do some bicep curls or 3 sets of 10.
You mentioned that you've worked with a lot of individuals. I guess this would be post-cardiac surgery or maybe even just early stages of being diagnosed with hypertension, high blood pressure.
Yes. So a large portion of my colleagues, after they graduated, went into cardiac rehab, actually. A lot of people in the ex-phys profession end up going into cardiac rehab. And so primarily the individuals that are coming here that may have hypertension, may have issues with their cholesterol, diabetes, and so forth, these are the folks that really need more than just a basic workout plan. They're going to require nutritional intervention, potentially supplementation, and really like a lifestyle change to see the improvements they're looking for outside of just, here's a pill or go, you need this surgery.
Sure. So you see a kind of a combination, serious individuals that come to your company that are wanting to make sure that they don't end up in the doctor's office as a patient. You see them coming in first, trying to be preventative. And then sounds like there's a second group of individuals that didn't think about that preventative. And now they're being more reactive and having to try to bring themselves back towards what I call a state of homeostasis. Is there an ability to do that after they have had some type of cardiac event?
Yeah. So I see patients, like you mentioned, primarily, ideally for preventative reasons, right? So to prevent issues from occurring. But even individuals who have suffered some sort of myocardial infarct or cardiovascular disease or some sort of congenital abnormality, they can achieve for them, an elevated state of health and fitness and ability. And it's not just based on like their age standard norm. It's something they can actually work to improve upon even prior to diagnosis. And so a lot of it is prevention, and hopefully I can be part of their treatment plan as well.
Sure. So when a lot of these individuals, like you're saying, are coming in, they have hypertension, they're having high blood pressure, maybe it's borderline right now, they show up sooner rather than later. Can you walk through what does that mean? What is, just for our viewer that is starting to get concerned about it, where's the guideline? What is it that we're calling hypertension or high blood pressure?
So clinically speaking, you want to be like, so 120 over 80, the systolic over the diastolic number. Anything above 129 over 89 is considered prehypertensive.
Okay.
And so from a clinical perspective, you want to keep those numbers on the lower side. I think that if somebody is considering starting a fitness program and they are hypertensive and it's not controlled, they should see their physician first to make sure it's controlled.
Sure.
And then the next logical step is, once it is controlled, I'd recommend checking out the American College of Sports Medicine website. They have great recommendations as far as protocols based on individual with cardiac complications.
So give me a little bit of the explanation when we're talking about high blood pressure, hypertension. What is causing that increased number from a pressure standpoint?
So it really is multifaceted. Part of the problem is society is becoming increasingly sedentary.
Mhm.
And that's obvious if you look at the data historically. So if you combine a sedentary lifestyle with probably an unhealthy eating pattern, people wake up in the morning, they're rushing to get to work. They probably have coffee on the way to work, and that's it. Coffee, being a diuretic, does promote elevated blood pressure. And then stressful day throughout their day, trying to just eat quickly. So if you combine a sedentary lifestyle, physical inactivity, if they are overweight, becoming more overweight, especially monitoring sodium in terms of the diet is considered, but also smoking is terrible for vasoconstriction. Alcohol, various medications, even things like contraceptives, increase blood pressure. And if an individual is already elevated, and let's say they're taking a beta blocker, that can actually impact their exercise capacity because it reduces resting heart rate. And so there's a lot that goes into it. And
Yes. Yes, very much. You just gave me a whole cornucopia of things there, but I did key on one term that you used, and I wanted to go back and ask you to parse this out a little for me. You used vasoconstriction, and there's another term, vasodilation, that goes with it. Can you deconstruct that for our viewers?
Sure. So quite simply speaking, vasoconstriction is narrowing of the blood vessels, and vasodilation is widening of the blood vessels. And there are certain things that can help enhance vasodilation, especially like what I do personally is, prior to exercise, you want to promote vasodilation to increase blood flow systemically into the muscles and so forth.
Yep.
And so anything that can really enhance vasodilation, as long as you don't have chronically low blood pressure, is actually a really good thing.
The whole podcast we're talking about here is designed to learn a little more about this gas called nitric oxide. And I think when you and I were talking last time, you reached into, I don't know if it was your medicine cabinet or something right there next to you, but we were chatting, and I think you had some powdered beets or something like that, or maybe it was a drink or something. So let's talk about nitrates, nitric oxide. What the heck is that?
Yeah, so I mentioned to you previously, every day I'll drink a beverage that consists of fresh squeezed watermelon juice. So I literally cut up a watermelon and make sure to include some of the rind, and I use the Vitamix to blend it up. I combine that with some pomegranate extract, which I just buy online,
Sure.
and some fresh lemon, and then just water. And then I also utilize beet gummies that I buy online. So the combination of things between the pomegranate, the watermelon extract, the beet gummies, they all promote nitric oxide production.
Great.
And that is what leads to vasodilation.
Okay.
And some of the things you'd find, like for example, in watermelon, it's high in L-citrulline. Citrulline, the amino acid, is a precursor to L-arginine, which then acts on the nitric oxide process. And so it's almost like a more effective way to cause vasodilation in a natural way, which I'm all about doing things naturally.
Of course. Yeah. So you just gave us your own concoction. I love it.
Yeah. It's the highest out of anything you could consume. Watermelon, especially the rind, is the highest for citrulline.
I'll be darned. So you take a little bit of that, but let's get in and talk about like citrulline. Citrulline, what is it? And arginine, give me a little step into the edge of clinical education there. Tell us, what are those things and why is it important for us to recognize those terms?
Sure. So they're amino acids, and amino
Hmm.
acids are the building blocks of proteins, and proteins essentially help to build muscle and promote health and so forth. The proteins are the underlying structure for everything in your body, essentially. And those two specifically, citrulline acts directly on arginine, which then impacts nitric oxide. Nitric oxide is a gaseous signaling molecule that
Okay.
plays a lot of vital roles in terms of production. And that actually, as you get older, it begins to decline with age.
Hmm.
And so it's important, especially if middle age or greater, to try to find ways to promote that and to enhance that so that you don't suffer the deleterious effects that may go along with a decrease in NO.
Sure. Okay. So you've seen the research as well that says as we get older, I'm guessing it's the cell wall or the cell itself that just starts getting a little tired, maybe a little lazy. It's not producing as much of the NO, nitric oxide, as it used to. So we got to nudge it a little bit. Obviously, with your advanced degree in physiology, I know there's going to be some recommendations for cardio exercise. Are we talking about strength exercise, combination of both? What are you recommending?
So first, yeah, so as we get older, the nitric oxide production decreases, it's less bioavailable, a reduction in production of that, and
Mhm.
also the signaling molecules begin to just get less efficient and effective. So it's
Okay.
multifaceted. And as far as an exercise perspective, I'm always fighting the good fight and trying to promote exercise. And
Sure.
it all comes down to blood flow in
Mhm.
terms of anything, in terms of wound healing and just general caloric. Actually, I'm standing and I stand a lot at my desk here
Sure.
doing my work because you burn more calories standing versus sitting just by the nature of gravity.
Sure.
And so typically, when you strength train, you're increasing blood flow away from the core to the distal muscle groups. Cardio is really effective for not only your heart health, but your lung health.
Mhm.
And so the combination of both is what I always promote, and actually in a manner that will allow folks to experience peaks and troughs in their heart rate.
Okay.
And so if you can deviate your heart rate from rest, the amount you can deviate it, how far you can deviate it, and then how fast it recovers is really indicative of cardiovascular health. One thing to keep in mind is if you're going to say, let's say, go do cardio, go for a jog or whatever, you want to try to see a recovery of 12 beats in the first minute after you've began to cool down, and then 22 beats after 2 minutes of after you've cooled down. If you're not achieving those two milestones, then you may want to go see your cardiologist
Mhm.
because there might be some sort of cardiovascular problem that's underlying. So a great way to burn calories and to burn through fat is doing intermittent cardio. So
Mhm.
peaks and troughs, right? Sort
Sure.
of going all out and then recovering. And so by going all out, I'm referring to exceeding about 80% of your resting heart rate maximal value and
Okay.
whatever that is you can calculate.
Sure.
And so what I try to stay is up between 80 and 90% when I'm going all out, and then about between 50 and 60 in those recovery phases.
You also mentioned that as we're talking about individuals as they're getting older, we're becoming more nitric oxide deficiency. You're talking about how we can exercise and the right way to exercise, talking about the right things that we should be eating. You gave us your great, I'm going to just call it the watermelon cocktail. I love it. It's going to be your own brand now.
Right.
For those individuals, since we're talking about the amino acids that aren't with their Vitamixer, or maybe they're not having their salad like they know they should, but they're busy, so they're cramming a protein bar or skipping meals. How does supplements coming in here when we're talking about these amino acids, and what are they and how do they work?
When you're doing your research, you want to make sure that you're finding a company that you believe in,
Sure.
that believes in natural products. So again, as I get older, we get more fatigue, we don't sleep as well,
Right.
aches and pains. And so I'm trying to just maximize my utility at every state of my life.
Taking those individuals also that are in cardiac rehab, and are you seeing values to them for these amino acids like arginine and citrulline?
For sure. And actually, my father-in-law, he is experiencing some issues in this realm as well. And I've been promoting this to him. I say, listen, you got to start taking your beet extract. And he's doing it every day.
Sure.
And so it's for what I do, it's a logical next step for individuals who are going through rehab.
Mhm.
They're often referred to me as patients from the physician and go see Dr. Fred. He'll take you through the next phase. And so I think that whether you are trying to avoid disease or you've been diagnosed with a disease,
Mhm.
it is often beneficial to at least try to find ways to ameliorate the side effects that come along with that and be your own best patient and try to find ways to improve your quality of life And I'm a firm believer that the products that I believe that I've researched are very effective.
You've given me some great insights, and I'm not going to forget the watermelon cocktail. In fact, that is now becoming top of my list.
There you go.
So I appreciate you giving me that. You've just given me so much information here. If someone needs to find you, if they want to look you up online, or maybe they want to find out what that a watermelon cocktail, how you develop that, being facetious, of course, but tell us how people find you, Doc.
Sure. So you could just Google the Fitness Doctor, Cleveland, Ohio.
Okay.
Also, my website is thefitnessdoctors.com, and that's doctors plural.
Yeah.
Feel free to reach out. I try to post videos on YouTube and get more active with social media as well, but I do have accounts on Instagram that I check frequently. I'm happy to answer any questions anybody might have, and I'm glad to be of assistance.
I really appreciate your time. You've been so awesome. And thank you again